Very good. Biggest problem with this fracture, actually with this splint, you're going to do this splint a lot. This is for mid-shaft humerus fractures primarily. Mid-shaft humerus fractures are very unstable. What does that mean? It means it moves around a lot. If I pick their arm up like this, it will bend here. It will not bend at the shoulder. They scream. The two most painful bones in the body to break, the humerus and the femur. By far the most painful. Why is that? Soft tissue. You have more soft tissue around the femur and the humerus than you have pretty much around any other bone. At least any other bone that we worry about. So how do I roll this splint on him without causing them a lot of pain? They can't hold their arm up. If I'm by myself, how do I do this? Even if I have another person to help me, how do I do this?
Hold it out.
Have them hold their thumb.
Let gravity help you. Hold their thumb out. Let them bend over at the waist. Here's a problem. A lot of these people have drugs on board because they're in a lot of pain. They get woozy. They want to vomit. Totally normal. I always try to make them sit, although some patients feel a little bit more comfortable standing. If they're going to stand, I have them lean up against something, kind of like this, and then lean over. Okay? But if they lean over and just relax, their arm comes out enough for where you to get to it. If you put this splint on, because none of you are really hurt, if you put this splint on with a patient like this, the parameters will be off. And I'll explain that as we go. So for now, you're going to hold your thumb. You're going to scoot your tush right on the edge of the bed. Keep going. You're going to hold your thumb. Lean way over. There you go. See how relaxed he is? I can get underneath here. I can get around. The parameters for this splint is going to be 2 to 3 finger breadths from the axilla, down around the elbow, and back up to the AC joint. Here's his AC joint, right there. Seems pretty easy, huh? We'll see. Remember, you have to pad a little further than your splint's going to go. Couple things with wrapping an elbow and an ankle is you end up getting a lot of wrap in here. That's the beauty of web roll. You don't have to do that. See, he's getting lazy. His back's starting to bother him already. That might fall down. You guys see how I did that? That is very, very tricky. I will wrap padding all the way up through the axilla. Now, I already wrapped plenty through the antecubital space, so I'm good with just patching it. These people must sleep at a 45-degree angle. Show me more 3-inch rolls, Mikey, or 5x30.
What?
5x30. 3-inch roll or 5x30s.